Okay, let's talk about supplies. The bare minimum supplies that you would need in order to perform vaccine administration safely would be something to clean your space. And you may be working in a vaccine clinic, a drive-through clinic, and not have the typical setup that we would have in a medical facility. So we have to still think about keeping our area clean and doing the best we can in that scenario. Usually there'll be a pop-up tent or a table or something that you can use, and the person that is preparing the vaccines will be in control of that space. So something to clean the area, something to lay down underneath to stay organized. Again, you have your vial of the vaccine or whatever it is that you're going to be administering. Once you have taken the lid off that vial, our vaccines are coming in multi-dose vials, but once you've taken the lid off the vial, we want to make sure that we use an alcohol, a clean, unopened alcohol pad, and then we would clean the top of that vial in between each drying up of each injection. You also want to have proper PPE. And again, in our shortages of supplies, I have seen some places where that are doing thousands of vaccines a day. They haven't been able to utilize gloves. And so, best practice is that we utilize gloves. But in some places, I have seen that they have not been wearing gloves in these unprecedented times. We do what we have to do, but the best practice is to wear gloves. And of course, we want some way of performing hand hygiene, some sort of alcohol hand-based gel that we can use in between each contact with each patient. You're then going to need your syringes and your needles. You may have the opportunity to have a what we call a draw syringe. Draw needle, and this is where these needles are meant just to pierce the vial and draw the medication out. They are not ever meant to use for actual administration, and I'll show you why. So this draw needle, let's see if it tells me the size. They call it a blunt sometimes, and this is an 18 gauge. So an 18 gauge is a large sized needle. I'll show you. You can see that here. And this is again meant to insert into the vial and draw the medication out. It does have a bevel, which is the area of the end of the needle that you can see the opening. So that's the bevel. And we do prefer to have the bevel up when inserting into the vial. It prevents the coring of this rubber tip. This is only to be used to draw the medication up. Using the scoop method, practicing our needle safety, we never want to just recap a needle. It's too easy to poke yourself. And so using the scoop method, we can put our finger at the edge of the package and slowly insert until we feel that click, and then we can remove this. This can't be used multiple times. A draw needle should only be used one time each time that you breach this vial. So that would go over to the side. And then a little bit about this rubber stop. I'm going to just use this to point to it. If you are inserting a needle into it multiple times, you kind of want to start making a circle around, because every time we breach that rubber, we are making a little bit of a hole, and eventually we're going to core it out. So we kind of want to move around. I think the vials that we're seeing most often for vaccines were entering 5 to 7 times. So we want to make sure that we're not going into the same place every time. So that's about the vial. And you might have just a larger gauge needle that you're using as a draw vial. This is a 20 gauge needle. And this is also something that I've seen in order to be able to draw up. Again, using the scoop method, if it does not have a safety on it, you would insert, remove, and have some sort of needle safety. If you don't have an actual needle safety repository, some sort of sharps container, then you would want to have a container that's specifically for that use, that is only entry only and not exit, so the needles can't come back out. The syringes that we are using for our vaccines are typically a 1 ml syringe, and this is what the package looks like, 1 ml, different brands. And I will show you as I hold up my other syringes here, the markings on these, and we will go over this in another lesson. So when we are giving an intramuscular injection, we have to think about the length and the gauge, which is how thick the needle is. So when we are talking gauges of needles, the larger the number, the smaller the size. So if I am going to be giving an injection into the deltoid, I'm probably, and I recognize that my numbers are backwards in my picture, but I am probably going to be using somewhere between a 23 or possibly even a 22 or 25 gauge needle, because it doesn't have to be very big in order to inject medication into the muscle. What I'm showing you here is an example of what the needle sizes look like next to each other. The other thing we need to think about is the length of the needle, because when we're giving an injection into the muscle, we want to just be in the muscle. We don't want to go past the muscle. So you can see here, both of these are 1 inch, and that's the appropriate size. They're actually the same size. They're 23 gauge, 1 inch needle. The only difference is this one has a safety and this one does not. So these are appropriate size for adult deltoids. This is what we would use for an adult deltoid, which is the muscle in the arm. If we needed to give an injection into the gluteus muscle, into the buttocks, then we might have to use a longer needle in order to reach that muscle, because we have to get through a little more subcutaneous tissue to get to that. So you can see that this one is a 1.5 inch. Now, depending on our supplies, we may only have the longer needles in order to give vaccines. So we just have to think about how far we are inserting that needle. And then this one here is a 25 gauge, so the smallest size, and it's only a 1/2 inch. Typically, this is what we use to give vaccines to children or to babies because those muscles are smaller. We also use this in adults if we're giving a subcutaneous, just under the skin injection. So those are our different sizes. I'm going to take some pictures and include them in the lesson as well. And we're going to talk a little bit about, let me pull this one up here. We're going to talk a little bit about the markings on the actual syringe. Again, I'm going to use my safety method of scooping into this needle so that I can remove it. When I'm talking about the markings here, I want you to see that this is a 1 ml syringe, and it's broken up into 0.1, 0.2, 0.3, 0.4, 0.5, all the way down. So when we are drawing our medication to the correct dose, we pull the plunger down, the top of this plunger down to the marking, and that's our correct dose. Now we have to put a needle on the end of this. And so if I were to pull it down to my correct dose and then put my needle on and then fill my needle with the medication, we call that dead space, because not everything comes right out of the needle. So we want to bring the correct dose down just a bit. And then once we have put our needle on, we're going to pull it off and put 1 drop of medication out the top of that needle to make sure that we have filled this dead space, and then we are at the correct area for our dose. Again, using my safety scooping method to cover that needle. I'm going to show you this a little bit closer. You can see the markings on this 1 ml syringe. You also need, for your supplies, alcohol pads and some sort of gauze or possibly bandages. Once you have given a vaccine, you may have to cover the area if you have a little spot of blood there. Okay, thanks for watching.